Dr. Melnick, let's talk about a bridge, which is basically, has been for a long time, for many, many years, the preferred and the best way of replacing a missing tooth somewhere versus an implant. Give us the pros and cons, and maybe even hint a little bit at the pricing difference which might be involved, at least in some feeling, like is it way out there, 10 times as much, 3 times as much, give or take, like give us a little feeling of that.
Well, my approach towards if you have a missing tooth and you're deciding whether to do a bridge, which is a series of crowns that connect to each other that are cemented onto each of the 2 neighboring teeth, versus doing an implant, is quite simply this. If the neighboring teeth next to the missing tooth have virtually no restorations, no fillings, no cavities, I would lean towards placing the implant, because placing an implant is doing localized surgery where you put a titanium screw in the jawbone, and it will preserve the 2 neighboring teeth. It also will maintain the bone underneath it. Now, if I had a patient that had 2 very large old silver fillings, or 2 very large relatively new fillings, but teeth that with large fillings are prone to breaking, I would lean towards doing the fixed bridge, because you would get basically 2 benefits. You would be restoring the biting strength of the 2 supporting teeth while making a replacement tooth at the same time. In terms of cost, there isn't a huge difference if you're talking about 1 missing tooth as to whether you do a fixed or non-removable bridge versus an implant-supported crown. It's about the same cost.
I see. And yet, I have heard, and tell me whether this is in any shape and form right or